Good afternoon, and thank you for joining today's Future of Health conversation. I'm Jason Marzek, Senior Director of the Adrian Arch Latin America Center here at the Atlantic Council, and I'm absolutely delighted to welcome Dr. Jarbas Barbosa, Director of the Pan American Health Organization. It's wonderful to have you with us here in studio with an in-studio audience, but I'd also like to as well welcome the audience joining us virtually, watching today's conversation via ACTV. And if you haven't yet downloaded your app, please go ahead and do so on the iPhone store. Dr. Barbosa, you bring great insight to this conversation and opportunities for building more resilient and equitable health systems across the region to enhance overall prosperity, which is a key priority of the Adrian Arch Latin America Center. Dr. Barbosa was elected director in September 2022 and began his term just 4 months ago at the beginning of February. He boasts over 30 years of experience in global health, health systems management, disease surveillance, and on prevention and response to outbreaks and pandemics. He served in senior roles at PAHO, Brazil's health ministry, and also within Brazil's health regulatory agency. At PAHO, from July 17th, 2017 until his appointment as director, he served as PAHO Assistant Director, leading 5 technical departments and PAHO's Revolving Fund, a world-class program to increase equitable access to vaccines across Latin America and the Caribbean. He also spearheaded the PAHO Task Force for COVID vaccination in the Americas. And today, with many countries now achieving high COVID vaccination rates, and indeed in many places higher than here in the United States, and recording considerably lower levels of COVID deaths, what we've entered is a new era with the COVID pandemic, a post-COVID era considered by many. But as we look at our region, how our region fared during the pandemic, the damage that it suffered, and even its relative success in vaccination campaigns, we can't help but notice several deficiencies in our country's health systems, such as unequal access, workforce and logistical challenges, budgetary constraints, and others. Identifying these gaps, applying the lessons learned from the pandemic in a forward-looking way, and outlining a joint path forward is critical to addressing these deficiencies. And Dr. Barbosa is here in studio today to help us do so. So Dr. Barbosa, again, thank you so much for joining us and for helping us to tackle some of these questions. I'm gonna get into my first question for you, which is the fact that last month, the WHO, the World Health Organization, declared the end of the COVID pandemic as a global health emergency. This emergency period started 3 years and 4 months ago in January 2020, saw nearly 7 million deaths globally, at least those that were recorded, and also taught us many important lessons. I think perhaps one of the most obvious lessons is the importance of robust health systems, and that should matter to every one of us, whether we're here in the studio or whether you're watching virtually. And this is despite the fact that this has been traditionally undervalued and I think underappreciated by many. So with the pandemic now in the rearview mirror from many people's perspectives, we started to see public health again being deprioritized in many ways. Is this consistent with what you've been observing lately in the region? Is the region going back to the pre-2020 thinking? And if so, how concerned are you?
Thank you, Jason, and I want to thank the Atlantic Council also for inviting me to be here. I think that looking at the regional situation that you have now, of course, that the pandemic was very important in the Americas, mainly in Latin America, for several reasons. I do believe that this highlighted how important it is to have universal health systems, to have access to systems. At the same time, it highlighted some important weakness that we have in many health systems in the region. The underfinancing, for instance, only 4 countries in the region are above the threshold of 6% of public expenditure with the health system, and many other weaknesses. At the same time, the visibility that the pandemic provided for health and how important and how valuable is health, not only health service, but the opportunity that people have to improve their well-being was very, very important. I do believe that, of course, we have a window of opportunity after all health crises, and we need to use this window of opportunity at least for 2 important movements, initiatives. One is to guarantee that the world and the region will be better prepared in a new pandemic. So to implement all the lessons that we learned in order to have a new instrument, a new agreement to face a new pandemic, to improve the international health regulation, to improve the national capacity with surveillance, integration with health services and surveillance, training healthcare workers in order to be better prepared to identify and to respond to a pandemic. And at the same time, to implement the lessons that we learn about how we can have more efficient and resilient health systems. Now we know that with our primary health care that is strong, that is renewed, that can offer health promotion, surveillance, prevention, care close to the communities, we will not be able to tackle the complex scenario that you have in the region. That we have some communicable diseases that still persist, like HIV, TB, malaria, dengue, and others. We have the permanent risk of new public health emergencies. We have the relevant burden of non-communicable diseases and the relevant burden of preventable deaths and premature deaths related to non-communicable diseases. We have violence and accidents, and at the same time, climate change impacts on health. So it's a broader agenda that you have for health sector nowadays. And the Ministry of Health needed to have this conversation out the health sector with the Ministry of Finance, with the heads of state, in order to provide some alternatives that can increase their capacity to strengthen their health system, to use some new developments that were developed during the pandemic in order to have a more resilient and efficient health systems.
So resilient, efficient, better preparation of health systems. Your concerns as we've emerged from the COVID emergency. You raised an important point about collaboration and internal and collaboration within governments, which we saw in many ways at an unprecedented level at the height of COVID. And reprioritization of health would really not have been possible without the policy, the budgetary, staffing, and other support that we saw. And that one of the lessons that I know that many of us believe fundamentally is the importance of health as an integral part of our economies and society writ large, as you were speaking about, and the importance of partnerships in that regard. So my question is, how do we keep moving forward? How do we keep the type of interagency collaboration moving forward as we saw during the height of the pandemic? What's the best approach to mainstream health policy and other health topics among non-health officials? So the importance of health beyond the traditional stakeholders involved in the health sector.
This is really important, and I think that maybe because the health sector has so many challenges, sometimes the Ministry of Health are not talking outside the health sector, what is very important. From our perspective also, and you talked about the multilateral agencies, for instance, we have had a very good collaboration with the Inter-American Development Bank to strengthen the digital transformation, to strengthen information system for health. But also the IDB provided support to a local producer in Brazil, Instituto Butantan, that is a pre-qualified producer of influenza vaccine. So this vaccine will be available using PAHO's revolving fund to other countries in the region. With IDB also, we had a very important initiative to eliminate the malaria in Mesoamerica. And Belize, just by coincidence, yesterday received the letter from WHO certifying. And this is the kind of dialogue that we need to improve. We also have had many good discussions with the World Bank, trying to identify some priorities for the region. The interests of the Ministry of Health and the heads of state, because to respond to the pandemic, it was not only the Ministry of Health, the Ministry of Foreign Affairs, the heads of state were directly involved. They are interested in many countries in the region to strengthen their infrastructure. So they are contracting loans to build the hospitals, to improve the health system. So it's very important part of this conversation to provide the projects that will really be more effective, that will make more difference in the people's life. So the population can realize that they are having more access, that they don't need to wait 6 months to receive a diagnosis if they have a cancer, another 6 months to receive the treatment, that they have access to treatment, to diagnosis, to medicine. So I think that this is part of the challenge that you have now, how we can use this interest and this visibility to provide the projects that will really make a difference to increase the capacity of our health systems.
And I would assume in that same regard, then showing the population writ large and others outside of the health sector, the importance of moving forward these projects, how these projects benefit the community and countries writ large.
Yes, and in many countries in our region, the rapid urbanization and the rapid demographic transitions are adding more challenge to the health sector. So we really need to use, for instance, telemedicine. That the telemedicine was there already, but the pandemic, I think that increased our capacity to use this technology, and PAHO is supporting some countries to use telemedicine to increase the primary health capacity at remote areas that could not be reached out if you don't use this kind of platform. And the other initiatives trying to have this multi-sectoral agenda. The Ministry of Health need to be need to have a very strong dialogue with their colleagues, not only the finance minister, but also other ministers that can contribute and benefit at the same time to strengthen the health system.
Yeah. And as we're speaking about the region's going to continue, and the world will continue to face shocks. I mean, you mentioned as well just climate change, right, and the impacts of that on not just the region writ large, but obviously on health as well, among the other shocks that we'll continue to see. Multilateral organizations can play and have increasingly played a critical role. What is crisis about? How do you envision PAHO expanding its collaboration? You mentioned a few examples, but how do you imagine that collaboration expanding with other multilateral partners, such as the Inter-American Development Bank, the World Bank, and potentially others?
I have mentioned some, but I think that at this moment we have one very important instrument, that is the pandemic fund. The pandemic fund was established and raised a lot of expectation. But the funds that are available are, I think, that only 30% of the projects that were presented. PAHO worked with the Ministry of Health, identifying what are the priorities to strengthen their national capacity. And I talked with the World Bank, with European Union, many other members of the board, calling the attention that Latin America and the Caribbean need support, that we are not a region where all the countries are middle-income countries with middle-income families. This is not the reality. We have a very important proportion of our population that have limited access to health service and social service in general, that are living in very extreme conditions, poverty and extreme poverty, so we need more attention. Some of these projects that I mentioned with the IDB, the World Bank, and now we are also seeing how we can support and provide technical support to the countries so they will use these loans that they are receiving from the countries in the better way to make their system more efficient. So it's not only to have a specific intervention to build a new hospital, but see how this hospital will be integrated with the services that are already there, how this hospital will be integrated with primary health care in order to provide the access to more specialized service. So I think that this idea to not have fragmented proposals that are being presented to the banks, but to use these loans that the countries are contracted with the banks in order to improve the health system. And we have established a very good dialogue with both IDB and World Bank that I think that will be very productive to achieve this goal.
And what's been the reaction as you're working with national level governments? You mentioned the very important idea of how to build a more cohesive approach to health systems, and the example of the hospital is a fantastic example, right? That maybe the hospital might be the shiny new object, but maybe that doesn't increase the efficiency as much as maybe investing more in primary health centers. What's been the response from national governments insofar as trying to develop that more cohesive approach as we emerge from the COVID pandemic?
We have had many positive reactions from the countries. I think that in many countries now they have realized that if they don't strengthen primary health care, renewed and strengthen primary health care. Because when primary health care was launched 45 years ago in Alma Ata, and at that time this was a revolution. Now, saying that health is not only hospitals, but you need to have this other level of care. But at that time, the epidemiological scenario was very different from the scenario that you have nowadays. So at that time, when we read the Alma Ata Declaration, it mentioned maternal and child health as the priority only. And now, if we are not offering, for instance, non-communicable diseases and mental health services at the primary health care, we are not providing access to the population. At the same time, we probably will overwhelm the hospitals and emergency rooms and provide a low-quality health care to the population. So the idea is to have primary health care not as a basic or a limited package of services to the population, but to provide high-quality services, care services that can solve around 80% of public health problems, the most important public health priorities in the country can be solved at primary health care. And primary health care can be a organizer of the demand to identify the cases that really will need specialized service. So I think that it's a kind of a win-win situation that we will strengthen primary health care and at the same time we will provide a better use for the specialized and very expensive service that the countries are implementing.
Excellent point. Now, there's many other important topics in the health space I'd like to get your thoughts on, your detailed thoughts on. I'll suggest 4. Of course, there are many others, and see if you'd like to comment on one or all these different topics. Digital transformation, equity. You just mentioned mental health, health workforce. What are those particular topics? Any of those particular topics, and maybe others? What keeps you up at night? What are you most concerned about that needs to move forward? And maybe it's all of the above, which is a fair answer as well, to really accelerate health delivery in the hemisphere.
No, I think that's all the above. Unfortunately, and many others that are really important. I will try to go briefly on each one. Digital transformation, I have already mentioned, is very important. Partnership with IDB, but we are also talking about not only telemedicine, as I mentioned, but also how we can use some teleconsult using cell phones, for instance, because sometimes we can provide a much better care for people with chronic conditions if we use cell phones. We are also talking about how we can improve the quality of the data. So the managers, the ministers, the managerial level of the Ministry of Health, they will know what is really happening with the countries. And we are also talking about increasing access, because if we have digital records, if a patient moves from a primary health care to a specialized service, all the information will be there. So it's not to make the care easier for the health providers, but also to improve the quality of that care. That is specific care. The other thing that you mentioned, mental health, PAHO established a high-level commission last year, because mental health was really, I think that's a topic that was really highlighted by the pandemic. It was always there. And the mental health was somehow neglected in many national health plans. But the pandemic, with the uncertainty, all the fear that people, not only the health impact, but the social and economic impacts also, many families that were facing, we had a very important increase in anxiety, in mental depression and many other health issues. In the Americas, we have had for the last 20 years an increase in the suicide rate for many different causes. So I think that I have a very strong commitment to translate these recommendations. The high-level commission presented their recommendation 2 weeks ago. 10 very concrete recommendations that we will translate in a plan of action, adapting to the national realities and to implement them. From community, what we will do at community level to reduce stigma, discrimination, what we need to offer at the primary health care and also more specialized services. But also talking about integration of these actions with other social services that can provide better support for people with health conditions. The other 2 topics that you mentioned,
Equity
about the
equity
that
and
is
also
very
health
important.
workforce as well.
Yes, I will let the health workforce to be the last one. Equity is a very important, unfortunately, issue for the Americas because we are the most unequal region in the world, not only among the countries, but also within the countries. Now we have, so we do believe that we cannot be successful in any program that we adopt, implement in a country if we don't try to identify what are the populations, what are the groups that are being left behind, in order to adopt some strategies to overcome the barriers. And we have many different barriers. Some economic barriers in countries that we have is still a very important out-of-pocket financing schemes to have access. But we also have some cultural aspects. If people that belongs to an indigenous group, they don't have access, if they don't feel comfortable, if they don't be understood when they go to a healthcare facility, probably they will not be there. And we have many other barriers that need to be identified because sometimes the average in a country in Latin America and the Caribbean is not that bad, but when you go below the national average, you really identify that some groups in Afro-descendants, indigenous population, poor families in the urban slums or in the rural areas are being, they don't have the access that they should have. And finally, healthcare workforce, that is a very important topic. And in most countries in Latin America and the Caribbean, they are complaining a lot because they don't have the healthcare workforce that they need with the proper training to face the new challenge that you have now. So I think that we have a most acute situation in some countries in the Caribbean because many nurses that they are training, they are migrating to Canada, US, UK, so this is a really important topic. In this regard, we are really thrilled to work with the US government following the announcement that was made by President Biden last year during the America Summit in Los Angeles, that launched the American Health Corps Initiative. I do believe that this is a very important initiative because we cannot have primary health care, specialized services, preparedness for public health emergency if we don't have a healthcare workforce prepared, trained in order to provide the service that people need.
Yeah. And I hear this all the time. I hear this not just from folks in the health sector, but people across other sectors of the economy, going the importance of health writ large across the economy is if you don't have the right healthcare workers, you're not able to attend to your population writ large, and thereby the resulting additional implications. Dr. Barbosa, you've been in your term now 4 months. Of course, you've been in senior roles at PAHO and other entities for a number of years. But looking back, what has been some of your major learning moments, or maybe some surprising takeaways that you've had on the job so far?
I think that at least it's one internally. I know PAHO and I know the people in PAHO and I know how committed they are. But I think that from the first day I challenged them to adopt some new initiatives to improve the way that we are delivering our technical operation. And I'm very proud and very happy to see that in these 4 months, next week, we will have the meeting of our executive committee, and we can announce many important changes that we have already made to increase transparency, accountability, and efficiency in the organization. Many of them are already adopted, and we will share this with our member states. That I think that is very important. In general, I think that it could take 1 year to be ready, but I challenged them and they reacted in a very positive way, and I'm very proud of this. I think that this is one thing. From an external point of view is also how nowadays, I think that the pandemic called the attention about the Latin America and the Caribbean. So PAHO need to be positioned in order to represent our region in many global forums. The first trip that I had was I went to Spain just after the WHO Executive Board, because I am I was elected by the Council of the America, but I also needed to be elected as regional director of WHO by the executive board of WHO in Geneva. So I went directly from Geneva to Spain to have a meeting with the president, Pedro Sanchez, because Spain will be the president of the European Union in the second semester, and I want to use the historical and cultural bonds that Spain has with Latin America to please, let's work to strengthen the capacity that you have in Latin America and Caribbean to have more resilient health systems, to increase the production capacity to be less vulnerable in a new pandemic.
That's fantastic. Well, Jarbas Barbosa, you obviously been at PAHO for many years, bring such tremendous experience, but impressive what has already been achieved in the last 4 months as you began your term as director. And also your vision for the region, right? And the importance of, as you speak about the importance of preparation, access, equity, resilience, and frankly, the urgency of the moment, right? That this is a key moment to be able to advance key health initiatives across the region. Never let a good crisis go to waste, and so let's not let the COVID crisis go to waste insofar as advancing more equitable health systems across the Americas. I'll say from the Atlantic Council perspective and from the Adrian Arch Latin America Center, we very much value our work with PAHO over the years, tremendous partners at PAHO, and again, thrilled to host you here for this in-studio conversation and look forward to many more conversations moving forward.
Thank you, Jason, for having me here. It will be a pleasure to work with the Atlantic Council, how we can have more stakeholders and other important sectors coming to this very important conversation.
Wonderful. Thank you so much, and thank you all for joining us, whether you're joining us via ACTV or whether you're here in our in-studio audience as well. With that, have a great rest of the day.